Started earlier than usual. It's type A, which is more aggressive, and this year's vaccine may be no match for it. Lauren Wonka reports.
Azure Albanese is happy her 2.5-year-old daughter Lainey got the flu shot this year, even though it may not protect her completely. The CDC indicates this flu season could be severe. About half of the H3N2 viruses analyzed are drift variants, viruses which are different from the season's vaccine virus. That means the vaccine's ability to protect against those viruses may be reduced, says the agency.
Now, there's different families or even species, let's say, of the flu virus. So that's when you hear the H3N2, H1N1. In each species, you can have family members.
Jersey Shore University Medical Center's Dr. Adam Kaplan says all those family members or virus strains are alike, but not identical.
When we choose the virus that's going to be in the vaccine, we are looking at these family members. But throughout the year, these family members can change a little bit, and you could have siblings. Now, you'll still recognize and match up, but they're not necessarily going to be exact fits. That's the, quote, drift that the CDC is talking about.
I think it's very scary, but I still think it's important to vaccinate your kids, even if it helps just a little bit.
The CDC did not return our multiple requests for an interview, but according to a release on the agency's website, the CDC strongly recommends vaccination, stating vaccination has been found to provide some protection against drifted viruses in past seasons. The CDC says influenza viruses are constantly changing, and the drifted H3N2 viruses were first detected after the World Health Organization's recommendations for this season's vaccine had been made.
These viruses replicate in the body to make it infectious very quickly. And all DNA and RNA, which what we're made up of, is made up of 4 letters. So go to your keyboard, type in a word that's 4 letters, and do it in a minute, type it 4 times. How many mistakes are you going to make? Probably not many. But if you're doing it very fast and only have a minute to do it 1,000 times, you're going to see that there's going to be mistakes in that sequence of orders. That's what's happening with the viruses throughout the year.
The sequence of the DNA changes slightly, creating the drifted virus. Because Dr. Kaplan expects more patients to get the flu this season, if someone comes in with flu-like symptoms like high fever, muscle aches, or a sore throat, as long as they've only had those symptoms for the past 2 days, his medical team will administer this rapid flu test. If it turns out to be positive, Dr. Kaplan will prescribe an antiviral medication.
And the antivirals up to this point have not shown to be any less effective against this drifted strand.
The Albanese family hopes their kids remain flu-free this year, especially since Dad Ed already got the bug.
I'm already on edge, to be honest. I think if I could have a triple flu shot, I would take one right now.
Dr. Kaplan insists all it takes is one shot. Flu activity typically peaks December through February, and the season can last until May. I'm Lauren Wonko, NJTV News.